My name is Gert Ossenkoppele. I am today in Munich at the 17th meeting of the Acute Leukemia Congress organized by Wolfgang Hiddeman. It's a very nice meeting devoted to acute myeloid leukemia, and I will speak this afternoon on the topic on measurable residual disease. And the clinical value of that in acute myeloid leukemia. And given the fact that a whole session is devoted to this topic, it shows that it's really timely to discuss MRD currently, because it has really clinical value currently. Many clinicians rely on MRD assessment during the patient journey in the treatment of acute myeloid leukemia. And it's well known that MRD, either measured by flow or by molecular techniques, is very informative for the treatment outcome. So when you are MRD positive after 2 cycles of chemotherapy, then the outcome is much worse than you are MRD negative before the post-remission treatment. And so it can inform your post-remission treatment. So often in, for example, the intermediate risk profile AML patients, you have to decide whether you continue with chemotherapy or an allogeneic stem cell transplantation, and MRD can be helpful in that respect. When you are MRD negative, probably you can continue with intensive chemotherapy instead of offering an allogeneic stem cell transplantation, because that is much more intensive treatment. But also after transplantation, MRD can be informative, so you can detect an early relapse and then respond rapidly, either by taking away the immunosuppressive drugs or starting a donor lymphocyte infusion much earlier than you wait for a hematological relapse. And the earlier you can treat your patients, the better the outcome will be. So there's a lot of development in the technology of MRD. For example, we relied for a long time on quantitative PCR and flow-based MRD. Now NGS techniques come along, and Peter Falk from the Hover Group have already shown the value of the presence or disappearance of non-DTA mutations after cycle 2 of chemotherapy. So also NGS is rapidly developing in the MRD assessment. So I think this afternoon we will have a very good session. Many speakers are talking on this topic, and I think it will be on the agenda of many meetings in the near future.